Hey everybody, my name is Andrew Paul and I'm doing my presentation for test and measurements on the alcohol use inventory. This assessment was developed by three different individuals, Wanberg, Horn, and Foster in 1987. And really the alcohol use inventory, the AUI, evolved from a bunch of different research studies that started in the 1960s that were seeking to support the multiple condition theory about drinking problems. It also developed from previous instruments like the alcohol use questionnaire, which all of Horn, Wamberg, and Foster had a hand in that, and the drinking history questionnaire developed by Horn in 1974. So basically, what the AUI measures is the patterns of behavior, attitudes, symptoms that pertain to an individual's alcohol use and what extent they're drinking. The inventory functions on 24 different scales that it measures, and these different scales assess behavior on three different levels, and they split that up into a primary, secondary level, and a third level. The primary scales focus on the benefits, styles, consequences, and concerns of drinking, while the second level scales provide a factor analysis of the primary scales relationships. And then on the third level scales, we see measurement of the broad involvement with alcohol. And so the 24 different scales within those three different levels measure a bunch of different things like social improvement, loss of control, guilt and worry, anxious concern, hangover, marital problems. And so, in their attempt to support the most multiple condition theory, they're really focusing on all of the different areas of an individual's life that could be impacted by excessive use of alcohol. Um, the test is beneficial in a bunch of different ways, but specifically to describe patterns of alcohol use and allow mental health workers to identify and understand the different kind of alcoholics and possible clients that they're working with. The norming population for the test happened at a inpatient drug and alcohol treatment program in Denver, Colorado, between the years of 1979 to 1984, I believe. The sample population was 1,290 individuals with a mean age of 38.16 years old. Males kind of dominated the sampling population, with 85% of the participants being male and 15% being female. Similarly, Caucasians in ethnicity dominated the sample population at 65%. 4% were African American, 9% Native American or Asian, and 22% Hispanic. So I think it's important to remember that sort of limitation when administering to this test or assessment to individuals of different ethnicities. Um, there were two different forms of reliability that were measured with the AUI: test retest reliability and internal consistency. Both of those have been shown to be fairly good across all but two scales. The quantity scale, which measures the amount consumed, and the marital problems resulting from drinking scale. The reliability coefficients ranged from 57 to 94, and the internal consistency reliability ranged from 0.67 to 0.93. And test retest reliability ranged from 0.54 to 0.94. For validity, there were measures of content, construct, and criterion validity. Wamberg, Horn, and Foster, who developed the AUI, suggests that it has strong content validity because only content related for decision making in the treatment program was included. Um, the age range for the test is adults or adolescents 16 years and older that are drinking to some extent. There was a note made by the authors that said this would not be a good test to give to people who don't drink, which makes sense. It would not really be measuring anything at that point. Scoring for the test, this was kind of difficult for me to find information on this. I wasn't able to obtain an actual copy of the test, but some of the articles that I read on the AUI or research that was done using the AUI um, revealed that the answers involve a Likert style scale that range from no, never to yes, often. Respondents' answers are scored to produce a raw score for each of the 24 scales measured, and those raw scores are transferred to a percentile rank for each of the 24 scales. And so, along with the results obtained in the percentile rank form, Wamberg, Horn, and Foster also do or suggest an interpretive report based on the respondents' results. And so basically, that interpretive report is going to be a hypothesis concerning the individual's use and misuse of alcohol. The test being in percentile rank form based off of a normal distribution operates off of a mean of 50 and standard deviation of 10. Some other things in the handout, you can find the publisher and distributor. Um, Previous editions we already kind of discussed. I guess some other important things. The motivation for producing this was really to allow mental health workers to understand and identify the different types of alcoholics, and so be able or equip the clinician with the ability to address uh, alcoholics individually with the different areas they're struggling with. Um, it was also developed to measure the multi-syndrome diagnostic model, um, which basically proposes that problem drinkers differ in their perceptions and benefits, styles, and consequences of drinking, and also how to deal with drinking problems. Again, so those 24 different scales uh, are measuring each individual's benefits, styles, consequences, how they deal with drinking problems, so the clinician can get an accurate picture of, of the severity, extent, and difficulties with the person struggling with alcohol. Some of the limitations, this test shouldn't be used with individuals under 16 years of age. Again, like I said, it's not appropriate for individuals who do not drink. Um, it is a self-report form, and so it's really up to the respondent to um, be honest and willing to answer the questions. Um, in an honest way, or else the results are going to be skewed. There may be hesitancies by some individuals to be portrayed as a chronic alcoholic, so they may not answer some of the questions honestly. But basically, the results and interpretive reports are all based on the fact that the individual is answering honestly, and so that can become an issue when someone isn't doing that. Um, Also, the norming and supportive studies have mainly been focused on Caucasian populations, so there should be some caution when administering and interpreting results for other people groups. Um, and also, interpretations are only provided for highest scale scores which limits interpretations pertaining to alcohol use and clinical uses for some of the scales where a respondent may score lower. Administration time should be about 35 to 60 minutes, and the test is going to be 228 multiple choice questions. This can be done in a pencil and paper self-administered form or a computered self-administered. Um, the test needs to be scored by a clinician, clerical personnel, or computer, and it usually takes about 3 to 5 minutes to score or 10 minutes for the computer interpretation. The authors also suggest that the respondent should be alcohol free for at least 8 hours before attempting to take the test. In the handout, you'll find some of the resources that I used. There is one in there for an actual interpretive report of the alcohol use inventory that was done by Horn, Wanberg, and Foster. And so that really lays out a clear picture of a results table as well as their discussion or hypothesis of this specific individual who took the AUI. And I think that's about it. Thank you guys for your time.